Hello, and welcome to another episode of Below the Hospital, an AME podcast on sterile processing and the issues that sterile processing technicians face today. I am your host, Garland-Rhea Grisby Sr., sterile processing manager at Sutter Health, CPMC, and long-standing AME member. In this podcast, I interview folks from around the industry about sterile processing and ask informative questions about our profession. Today, I have the pleasure of speaking with someone I've known for some years now. She's an amazing infection preventionist, Sherah Bateman. Sherah is an experienced infection control professional with 8 years of experience in acute care hospitals, covering everything from surgical site infections, device-related infections, environment of care concerns, infectious disease exposures, and everything in between. One of her favorite departments to partner with is all of Peri-Op, including SPD, and Sherah is always learning something new. Her favorite part of infection prevention, of the infection prevention world, is the ability to collaborate and empower her colleagues to keep the patient safe. She holds a Master's of Science from Georgetown University and a Master of Public Health from Des Moines University. Sherah, welcome to the show.
Thank you for having me.
So, Sherah, is there anything that you would like to share?
Yes. So I just wanted to say that the opinions expressed today by myself are my own and not of my employer. So I'll just state that first.
Thank you. Thank you. So let's just dive right in here. So, Sherah, for new sterile processing techs and scrub techs, what do you wish they knew about your work or infection control more generally?
Yeah, that is a great question. So I actually think the most important aspect of infection control or infection prevention for all healthcare workers, so would include sterile processing techs and scrub techs, would be standard precautions and understanding what that is. So standard precautions includes 3 components. It's hand hygiene, surface disinfection, and PPE, personal protective equipment. So these 3 items are the cornerstone, kind of the back to basics of infection prevention, and it's the cornerstone of how to prevent infections in the hospital, and cannot, be applied to the inpatient side, outpatient side, and also any ancillary department settings.
Nice, nice. So, what role does infection prevention play in the entire effort to keep patients safe and prevent HAIs or healthcare associated or acquired infection?
So infection prevention, as I mentioned, it touches all parts of the hospital. So everything we do can be applied to all settings. And so our day-to-day changes, which keeps the job very interesting. It's one of the main things I love about this job is the day-to-day changes. And then, so, one day we might be working on an infectious disease exposure workup. The next, we are focused on environment of care rounds on an inpatient unit, all of which is focused on keeping our patients safe and preventing HAIs. So we track all hospital-acquired infections. So that's including our central line-associated bloodstream infections, our surgical site infections, our catheter-associated urinary tract infections, and hospital-onset fever infections. And we focus on how we can prevent these daily. We do this also by collaborating with all units and departments to focus on prevention initiatives, which keeps our patients safe. So we may be rolling out a new product on the ICU, for example, and doing education on that, or maybe presenting on hand hygiene in an outpatient clinic. So there's always background work going on to enhance the safety at the hospital and in the outpatient clinics as well.
Nice, nice. Now, you mentioned collaboration. So, a question there. So, in your experience, how do you and your fellow infection preventionists act as a resource for SPD staff?
So we interact with the SPD the same way we do for all units and departments, and I kind of look at it as an active service. Our goal and my goal is to always provide guidance and assistance and help as much as possible as it pertains to infection prevention and control in that specific space, because each space is going to have different issues that they want addressed. For example, I might reach out to the SPD manager or director and ask them what infection prevention topics I can assist with, and then create education and guidance based on that. I also round weekly to check in with the staff and kind of survey what issues are happening in the department so I can formulate a game plan on how to help. So it's really twofold. So SPD will come to me with concerns and I'll tackle them. And then I also approach them to ask how I can help. And so I really consider myself a part of their team as I do all units and departments. And this helps, I think, a lot in them seeing me as a valid resource.
That's great. I'm glad you broke that down like that because all too often in the SPD world, some folks have had bad experiences with infection prevention, or
Mhm.
they look at infection prevention as being against them or trying to find something. Um, but in my years of experience, I've learned that no, infection prevention is actually there to help us, to keep us out of trouble, to let us know where our deficiencies are, because sometimes we get so tunnel vision we don't look outside the box, and then that's
Mhm.
where you folks come in as infection preventionists to help us and get us a little bit back on track, so to speak, where we may have you know deviated a little bit. So thank you
Yes,
for breaking that down.
of course. Yes, we are your friend. We're here to help.
So regarding your role, you talked about rounding and meeting with staff and SPD management. So what's your role during these inspections and similar interactions with accreditation and certification bodies?
So during inspections or surveys, I will generally help prep the department while we are in a surveyable window. Sometimes we know when surveys are happening, sometimes we don't, but we always want to be survey ready. I want to make sure they're on top of everything and they also feel comfortable. I want the staff to feel comfortable with any infection prevention concerns. And so this is why rounding at least once a week in SPD is always a good idea, because you want to have a quick check in, kind of round and see what's going on, and then talk to the staff to understand what their needs are. And then when inspections or surveys are conducted, when they're actually happening, I'm typically going to be on standby to help answer any questions and support the team that's needed.
Nice. And then I just want to personally thank you for the support that you provide for the SPD folks and for all of those infection preventionists out there that assist SPD. Thank you all. So, in your day to day, I mean, you touched on it a little bit, but what are some things that you look for when you work with SPD? Um, yeah, let's start there.
Okay, yeah, no, great question. So when I round an SPD, I'm checking multiple different things. So the first thing I'm looking at is environment of care. That kind of always sticks out first, right? So for example, are the floors clean? Is there dust? In addition to that, I'm looking at standard precautions. So, is there adequate hand hygiene available? Is it expired? Is there, are there towels at the sink? Are the staff wearing the correct PPE? Are they gloving appropriately? Is there adequate cleaning products for staff to wipe down their stations? If I see EVS in the department, I'm looking at, are they having challenges or, are they doing their job appropriately? Do they need support? I'm also looking at the function of the SPD equipment. So, is it working correctly, or is something down maybe for maintenance? And would this impact operations or safety? Or do we have current construction projects going on that might limit maybe the operations of the department, which would then potentially cause infection prevention issues. So this is really just a sampling of things I look at, and if all of those are in order, then I can typically say SPD is functioning well, and if they're not, then I will focus on those issues and try to help and see how we can fix it.
Aha. So now here's the question about a well functioning SPD, right? So you mentioned the things that you look for. So, what are some of the indicators for you when you walk into an SPD? What shows you or tells you that they are functioning well?
So yeah, so it's all those things I kind of mentioned. So if I see this that the staff are wearing the proper PPE, I can say, okay, they've got this down. If I notice that staff are cleaning their hands before entry into a space and exit of a space, right? Because a lot of times, especially with hand hygiene, we think about, oh, we only need to do that when there's a patient. But it's really important for us to do that in all departments and units, and any time we're having any interaction with any kind of patient supplies, which would include SPD. If I walk in and I see that the floor looks really nice and shiny and I don't see any dust, then I can say, okay, everything's working well here. The other thing I like to do is I like to I love to use spot checks on peel packs and
Hmm.
sets as well. That's something that I do on a regular basis, and this helps me confirm that we are in compliance too. So if I see issues with our peel packs, I'll bring those back to SPD. I'll see if we can get those reprocessed, but I'll also ask, why do we think this happened in the first place? So, again, when I see all of those different things in place, then I can say, okay, this SPD is functioning well.
Nice, nice. So You mentioned looking at pill packs and things like that. Um, so, what are some of the resources and guidelines that you rely on for your job?
So I rely heavily, of course, on the guidance of our own policies. Just as every hospital has policies, we want to make sure that we are looking at our internal policies first. The other thing that I do is I rely a lot on APIC guidance from APIC, and APIC is the Association for Professionals in Infection Control and Epidemiology. And they are kind of the go-to group for infection prevention. So I'll look at their guidance. I also rely on guidance from CDC, AORN, SHEA, and of course, Amy, of course, has been incredibly helpful. So all of those national organizations are beyond helpful whenever we have any kind of question, because even with the 8 years of experience that I have, I'm still learning. And I think that is really the key is that all of us in infection prevention, even if we have 20 years experience, we still are learning. And that's what I think I love about this job is I learn something new every day.
Yes, healthcare, be that SPD, peri-op, infection prevention, infection control. We will never stop learning. We will never stop learning. I've been in the game for a long, 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 long time, and I'm still learning. So it's something that we will always do.
Yes.
So Shira, is there any advice for folks in sterile processing, peri-op, surgical techs? Any advice for them for those that want to learn more about infection prevention? And if so, what resources should they seek out?
So I recommend anyone with an interest in infection prevention to reach out to their local infection preventionist at their facility to ask about resources. Especially kind of reading through the local infection prevention policies, your internal policies, really familiarize yourself with those. And then in addition to any education resources that your local infection prevention department may have created, because we love to create tip sheets, we love to create all kinds of things in terms of education. And then in addition to this, all the organizations I mentioned previously are right. So APIC, CDC, AORN, SHEA, Amy.
Well, thank you. Is there anything else that you would like to share about your profession as it ties in with SPD? You've given us so much information here. Definitely beneficial for our listeners. But is there anything else that you'd like to share?
I just want to say thank you for having me on this podcast, and also, the infection prevention field is a great field for anyone who is interested in it. I absolutely love it, and happy to be here. Thank you.
Well, Shira, thank you. Thank you for taking the time out. I know you're super busy. And the world of infection prevention is outrageous. There's always something, sometimes we just think about our own department in SPD, but you cover a whole facility, be that outpatient or inpatient. So we want to thank you for hopping on and speaking with us today.
Thank you. I appreciate it.
So, folks, as usual, I hope this episode has been useful. We'll be back in 2 weeks with another episode. If you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcasts, YouTube, and Amy Array. Until then, see you when I see you.